think you highlight some very important things. We have a very large clinic and we have a huge infrastructure that we can provide these things to you, but you highlighted something that I also take personally. I don't often offer this at the first visit, and what I mean by that is we are so focused on the stage, the diagnosis, the treatment, that we fail to incorporate that, and that's very good feedback. Get it incorporated early in the course so that you're not trying to react to symptoms that are hard to control. If you can stay ahead of them, I think sometimes you'll have better symptom management. The other thing that I think is very important is, as you mentioned, you've been very resourceful at identifying other sources of information, doing your own research. And I think some patients maybe are not quite as self-motivated as you are, and they may need more support from their clinic team. So asking your nurse if you're not comfortable asking the physician. I think sometimes patients are of the impression that if they start asking about alternative medicine or supplements or things that are not viewed as traditional medicine, we may be turned off by that. And I don't think that to be true for the vast majority of physicians. I think we want to be able to guide you and advise you, but if we don't know those questions exist, it's hard to approach them.
And I have to say, I agree with that, because I myself was very cautious, because at first I didn't want to, I guess, offend you that you didn't think of this, but you've since made me a lot more comfortable, and I have found that more is better here, and to have complete honesty and check modesty. Some of your side effects are uncomfortable to talk about, but you have to be able to have that conversation with your doctor, or you're just going to have to suffer with it. And so once you kind of check modesty and have that open conversation, then you're able to think outside the box if you need to get to a place where you can have success in managing and monitoring and hopefully eliminating some of those impacts that you have from the medication, or just to kind of overcome some of those things. So I was intimidated at first to talk to you about, can I try this, or what do you think about that? But once we crossed that barrier, it was a floodgate opening for me of, okay, yes, I can check this out. I can go and I can talk to this person. I can meet with this acupuncturist. I can talk to this massage therapist. I can, really make these changes, and she supports that, and it's together, it's integrative medicine. And I think that is what made a huge difference in my first round of side effects, and then my second round, I rebounded so much better once I incorporated all these. So I experienced it without and with, and can truly speak to it made a huge difference in my recovery going through the cycle.
I agree, and as you mentioned, this is a partnership. We're only going to be more successful if we share information, we have open dialogue. And I think there are certain times where I may advise against certain things, meaning if your counts are very low, if you're having fever and we're concerned about infection. So I learn from you, I also share advice from you, but I think this is something that most patients should feel more comfortable talking about. And if they need a segue via a nurse or an advanced practitioner to have that conversation, explore those options.